everyone. My name is Jamie Smith. I will be your host today on Nurse Deck Podcast. And today we have Dr. Rana Abdel Malak to interview. Hi there.
Hello, how are you, Jamie?
Great. Thank you for your time today to interview you.
Thanks for having me.
Yes. So tell our viewers, our listeners, how did you get started in nursing? Tell us about your journey and what made you decide to go into nursing.
Well, I grew up in Beirut, in Lebanon, in the post-Civil War period. And I've seen a lot of trauma casualties during my growing up years. And this, I wanted to really help people around, be there for first aid, be present during emergencies. And I studied nursing at the American University of Beirut just after the war. So my first year, my sophomore year, was when the civil war in Beirut and Lebanon ended. So my training years at the American University Hospital were it was a recovering period for this great institution. And you can imagine post a devastating war, a city that was shredded for 15 years of war, how things were. Nothing was working. All the systems were being reconstructed from scratch. And during that time, I started my BSN in nursing at the American University of Beirut. From there on, things rolled on for more and more. I was always somebody who wanted to know more and to learn more. So I graduated after 3 years on Dean's Honor List and started working immediately as an oncology nurse. After that, during my working years, I enrolled in master's. So I was doing my master's degree while working at the same time. And back at the time, the American University of Beirut didn't have any master's in nursing. So I specialized in population health to study all the issues related to public health in general, and especially in relation to vulnerable populations. And I kept working as a clinical nurse for 6 years. After that, during my master's year, things were different for me. The master journey was transformative in a way. It helped me think differently. It helped me see linkages in data, be more analytical. This preparation at a graduate level put me at the forefront with my colleagues in my team to really push forward for things for them, like when we had shortage, when we had maldistribution during the scheduling, the way scheduling was done, when we have seen, for example, IV phlebitis rising, how we really started doing little performance improvement project at the point of care. So. And this really put me under the spotlight for my seniors, and they invested in me being promoted to be a project manager. And from there started the journey to being a leader. So I was leading projects that were put there just for improvement purposes and for redesigning the nursing service administration at the American University of Beirut to put them back on the map, on the international and global map. So I run projects like Magnet Designation, like the ANCC certification for competencies and for professional development, and so many other transformative projects during 10 years. And this is where I discovered that my penchant, if you want, or my leadership abilities that were not really, in a way, conventional, like being a nurse manager, but running projects where you have many stakeholders and you have to really influence and persuade people to be on board so that your project will succeed, and this will have a ripple effect by having a positive outcome that is the intended positive outcome being realized. So basically, this is my track. My track in leadership was never conventional in a way.
Wow. Yeah, I don't even know where to start. Yeah. So you said you mentioned war. You said you've seen trauma while you were growing up. You became
Mm-hmm.
interested in emergency situations. You ended up getting your bachelor's degree in nursing. Things rolled on. You became more interested. You wanted to learn more. You worked as an oncology nurse. You ended up getting your master's of science in nursing in population. You said in population health. Is that
Population studies, population health studies.
yeah, and you ended up working while you were getting that. You ultimately became a leader. Things rolled on for you. You ended up becoming a redesigner, you said, for the nursing services. And
Yes,
you,
anyway.
yeah, and you mentioned magnet designation for the AANC. Is that right?
Yes, Magnet Designation, ANCC, Professional Development Provider Unit Accreditation, Competency Accreditation for courses. That was like, I'm trying to really lump up here a career of 15 years in like 15 minutes. So this is basically was my role at the American University of Beirut, and I really owe this place a lot because and I owe the senior leadership in that place a lot. In a way, they were mentors, and this is which brings me to another point in leadership. What really makes a good leader is really one of the things is to be mentored the right way and to have the right opportunity to be developed as a leader. Uh, Especially as an experiential leader, because you don't learn leadership only in books. You have
Right.
to really put that into practice and really it's a process that is co-constructed. I say that, and this is one of the things that I have wrote about in my doctoral dissertation. It is co-constructed with the people. You cannot be a leader that is detached from the people whom you are leading. So this co-construction or co-creation of leadership, there is a diad that's happening where there is an exchange. And there is where you test also the quality of the relationship all the time as a leader, and you need to really work on improving it. And I think this is one of the things that we are really missing still in nursing. We really don't test the relationship with our people. We just make it one way, or we try really to implement things the way they are or how we learn them. But they don't necessarily fit the situation where you are practicing. So and my doctoral degree was really enlightening in this way, because it was something that I wanted to study, how we lead, how to lead, and how to really lead in an effective way. One of the things that I measured was engagement in nurses and job satisfaction, based on the quality of the relationship they build with their nurse manager. I was really focusing on the diad that happens at the point of care, because I think this is one of the most important diads in the entire healthcare system, where many things gets hidden and happens, but we don't know how they are being done until you pass through this stage. So I still believe, I'm a strong believer that leadership needs mentorship,
Oh,
experiential
yeah.
mentorship, lots of development, and the leader has to do a lot of personal education, like personal development on his own, plus a certain mindset that when you are a leader, it's not that it's about me, it's about the people I lead, and how I bring them on board to where we want to go together.
Yeah,
So this is a big discussion.
it is. Yeah. So tell us, what do you think drives you to nursing leadership? Um,
It's
how
a
did
very
you?
good question, Jamie. I like this question a lot. What really drives me to leadership is the potential, or the possibility of transforming lives and doing change. So personally, I really thrive on change and growth, and transforming other people's life is very important. And when you see that happening in front of you, it's like growing your own baby.
Yeah.
It's This is what really drives me in leadership. And when I was not able to really do that anymore, I really changed paths to consultancy, because I'm practicing right now in consultancy, but still located in Lebanon. and Lebanon is passing through a historical economic crisis on top of the pandemic. So our healthcare system is really struggling at many levels, and we have not only shortage, it's a drain, it's a brain drain of all our nurses and healthcare provider, even doctors. So the wave is much stronger than you can imagine. So when I was not able to transform lives and really step forward to really do growth for these people, because the situation is really beyond my capacity as a person, I chose to really move into consultancy and leadership development training and professional training. So to answer your question, yes, these are the two major drivers for me as a leader.
So the driver is about making a difference, the potential of transforming lives.
Mm-hmm.
Thank you for that. So for those who are listening today, what tips do you have for those who are interested in going down the same road?
Definitely, you need the stamina and you need the perseverance. Mm-hmm. That's at a personal level. Let's really work around it, divide it into quadrant. At a personal level, they need the stamina, the perseverance, and the will. And they have to have some rough skin. So if they get some punches in the face in a way, they have to really back up. And they need to get a good mentor. And mentors in the leader life, they change. So they are not necessarily one person. You can have many as you go. And these are, in my own personal experience, mentors. I have mentors across phases in my life. So each phase had somebody who really was there for me and really walked me through the path. And they need to do a lot of personal growth, reading, training. They have to have a curious mind, because it's something that is always growing. It's not like a straight line thing. And at the end, they need to get certified. Why? Because certification would give them this validation for the others, in front of the people who will be around them, for the board members, for their followers, for their colleagues. So this stamp of certification will be like telling them that you have this validation about what you already know and what you have passed through. So basically, these are my 4 tips to everybody who would like to go this path.
I like it. So you said they need stamina, perseverance, and the will, rough skin, so to speak. If you get knocked down, you get back up, you keep pushing forward. You need a good mentor. Keep reading, keep training. Like you said, it's not a straight line. You have to keep growing and get certified, get the stamp, so to speak. Is that right?
Yes.
All right. So what do you do to ensure your own leadership growth and development?
I do the same things that I was telling you. I'm dual certified. I'm not certified in one by one entity. I'm certified. I'm a board certified, American board certified as a nurse executive advanced level, and I'm a certified by ICN as a global nurse consultant in leadership specialty. My specialty is leadership. So I'm a dual certified. I read a lot. Actually, right now behind me, you see part of my library, in addition to whatever I have on my laptop. I don't read just for reading. I learned to read things that would really help me build opinions, build questions for the research, for anything that I'm doing. So, I have targeted readings. And definitely I still have mentors till this point.
Okay. Dr. Abdel Malak, can you tell us, what can you say about the state of our acute care systems and clinical processes amidst the COVID-19 pandemic?
Well, I think the pandemic has really exacerbated the vulnerabilities in the healthcare systems everywhere, not only in the United States or here in our part of the world, everywhere. COVID-19 exacerbated all the vulnerabilities and the weaknesses in the healthcare systems. And what we are seeing right now, all this, all this negative things that nurses are experiencing, shortages, burnout, severe emotional exhaustion, are results of the exacerbation of our vulnerabilities. These vulnerabilities and weaknesses were always present. We were always talking about workforce issues. We were always talking about waves of shortages. We were always talking about our nurses leaving the profession and always having the intent to leave the profession after a certain number of years. When came the pandemic, we were not ready, not as a profession, as countries, because right now what I'm going to talk about is no more related to nursing as a profession. We are trying to solve our issues as a profession without really extending this to global level. It's a global issue. It's no more a shortage that's happening in the United States versus a shortage that's happening in Europe or somewhere in Asia. Right now, it's a global issue about people who are in this profession. They need to be protected in a way to remain in the profession so that our healthcare systems globally are sustainable. Or else we will not be able to, in case we have another pandemic coming up, we will not be able to really pick up ourselves. Okay,
Right.
we need really system changes that are of global scopes. No more solving our issues at a state level or at a national level. I can tell you, you cannot keep nurses by only throwing money on the problem, like paying them more. Right now, we need to think about out-of-the-box solutions, like shorter shifts. And this is like paying money, but in a different way, to keep them. Because what is driving them outside the profession? The profession is an emotionally exhausting profession, especially if you are dealing with high-risk populations. Like cancer, oncology, pediatric oncology, you name it. Okay, so it's a high-risk profession, and let's treat this profession the way we treat all the other high-risk profession. I give you an example. For example, people who work in the sea where they extract oil, like what do you call that? They work on platforms for oil extraction. This is a very high-risk profession. All the engineers that work there, they have very, very short period on 10 days on board, 10 days on Earth. So pilots, let's learn from other professions and really bring this knowledge, this appreciative inquiry to nursing. I'm sure we need shorter shifts. The 8-hour shift will no more work. We need shorter work weeks that are shorter. It's not about only giving money. You can give money, throw money on the problem, and people will remain, they will burn out at a certain point because they are physically and emotionally drained, and they will leave the profession to do something more convenient to their families. So we need to break the cycle and learn from other professions who are high-risk professions, what they are doing to keep their people on board. And my other message, it's no more the issue of one country versus another, what they are doing better than another. It's a global concern that needs a global approaches and solutions.
You couldn't have said that any better. I was making notes as you were talking. I liked how you said COVID-19 has exacerbated the vulnerabilities in the healthcare system. It's not just the United States, it's a global issue. You said it has ultimately impacted nurses leaving the profession. You can't fix the problem by throwing more money, which is a powerful statement because we're human, okay?
We're human.
You're human, and we get burnout. We can't keep working these long hours and long shifts for, several consecutive days. You said we need to break the cycle and learn from other professions. And I want to point out this part right here. You said such as working shorter work weeks. Is that right?
Yes, shorter work weeks and shorter shifts. So like instead of working 8 hours, you work 6 hours. And instead of working like 5 days a week or 4 days a week, you work 3 days a week. It's eventually, if you want to translate this into a money figure, this is going to be throwing money on the problem,
Right.
but really solving the problem for the nurses and keeping them, like throwing the money once for all. It's not like every time you have a shortage, we increase the money for the nurses and they stay for a while. Then when they get tired, they get super tired or exhausted, they would leave the profession, and we go into the cycle again. And another thing that really I missed to say before, and this thing I have learned it before the pandemic. I have learned the importance of really investing in staff well-being, mental and physical well-being, by really leading one of the hospitals in Lebanon to be Plaintree Gold designated. And you know, Plaintree is about person-centered care. This is the ultimate designation for providing person-centered care. And during this transformative experience in leading this hospital and leading the nursing department in this hospital to achieve the gold standards, one of the things that I have learned before the pandemic was when I was leading a nursing department through the person-centered care gold designation of the Plaintree designation. And the standards for this designation, really, they push the hospitals or the healthcare systems to really implement in their systems, okay, so in their organic state, actions, interventions, and program for the well-being of the nurses and the healthcare providers, everybody, in addition to the well-being of the patients. So it is built on the premise that healthy workforce provide excellent services. Okay, so I think these people, they got it right. And it's not that I'm promoting Plaintree designation standards, but I have really firsthand experience in seeing the transformation in an environment where this has been put in practice, and how these people during the pandemic, definitely they will get tired, they will get emotionally exhausted, but they were in a way more resilient for a longer period of time before really falling out. Okay, so if this sort of programs were built, like, and these programs are mandatory programs. You need to do the all those health, wellness, and training for decompression after certain long hours. So like healing gardens, leadership walk rounds, you name it. So it's a list of many interventions. In addition to what I was telling you, the shorter weeks, shorter shifts, I think this is where we can have a comprehensive solution for whatever we are passing through in our healthcare systems. So I think it's beyond anymore. It's beyond really solving the issue at a certain hospital level or at a certain country. It's really adopting standards for the well-being of those people who are really at the front line and performing a very high-risk profession. We need to really admit we perform high-risk profession. So how we treat people who perform high-risk profession. And we need to really acknowledge professionally, nationwide, global-wide, that if nurses are not able to practice to their fullest mind, body, and soul, they will not be able to provide the care that is expected from them.
Right.
You cannot really take something out of an empty cup.
I like the way you worded that. So, what are the major challenges and changes that you currently face in your nursing leadership role in this time of pandemic?
Well, there are many challenges because where I practice in a place where we have a compounded level of complexity. It's not only the pandemic. We have, before the pandemic, it was there, we have a very economical crisis that is really devaluating the money. So the pay for our nurses has been devaluated. Plus, we had the August 4th disastrous Beirut blast that really blasted away in half of the city or more. So, and I was practicing back at the time during the August 4th, and I was practicing in one of the healthcare centers that was less than a mile away from the blast site. Yeah. So, also leadership during disaster is very important. I have wrote about this, presented about this, and personally I went through a PTSD cycle because I needed somebody to help me come out of the trauma of seeing so many casualties and not being able to help everybody. So to go back, the challenges are many because we are in my part of the world. We are not practicing under only the stress of the pandemic, but we are practicing under many other stressors that are creating a very complex situation for healthcare systems. So leaders, they need to really be sensitive to this level of complexity, and try to, as much as they can, um, uh, be close to their people, and at the same time uh, keep them on track, so that eventually they don't lose the standards, so they start practicing like shortcuts and so on, because they are tired, and at the point of care. So we want this is a very challenging situation, because every day is more difficult than the day that went. Every day you lose somebody because they want to migrate to somewhere where they can get better pay, or they are leaving the profession altogether. So the level of complexity is by the hour, and I think the type of leadership has to be a very flexible, authentically type of leadership, in addition to all the servant leadership component in the practice. So being there to serve you and help you.
Did I hear you say you were a mile away from the blast?
Yes, a mile away. Yes, I was practicing in one of a healthcare center that is at less than a mile away from the blast center.
Wow. And you said seeing those casualties and not being able to help everyone was obviously.
Yeah, Jamie, we had in the first hour, I could reach the hospital because I was in the suburb of Beirut, and it occurred at 6 p.m. I have already left the hospital by that time, so I had to return back. So the blast occurred at 6:07. I was there at 7 p.m. again, present at the hospital site. I had to do a very big detour to reach because of the rubble and the debris. I could not go through the regular paths that we needed to for us to reach the hospital. So during the first hour only, we have seen more than 500 casualties. So the people who we could really like list were 500, but we know that we have seen more that we could not list. So, and I have presented about this on 2 conferences, and I'm planning to write about this experience for people to really get the lesson learned from that. And it was therapeutic to me to really get it out of my system and really help others by writing about it. We were on the verge of really like complete system failure. Like how the body would fail in ICU when you have like people who are like in septic shock and complete system failure, and you were on the verge of really reaching that point.
Wow, I just can't imagine.
It's so many vulnerabilities that, on top of the pandemic. So the pandemic is one of the concerns, but really it's not really the main concern.
Right. So how do you feel about the current working conditions for nurses, and what can be done to help with nurses' short staffing and burnout?
I already said to you what should be done, but for my where I'm practicing right now, one of the things that is very important is how to really put a structure for violence against nurses, because especially in high-risk areas like ICU and ER, we are having a lot of assaults on nurses, physical assaults on nurses, because they are the frontliner, and they get, for example, for ER to receive some care, and the bill is something that they cannot pay, and they start the conflict with the nurses on the desk, and it turns out to be a big mess, plus a lot of violence and assault. So, and this has been like a prominent thing for us in the past few weeks in Lebanon. And my 2 cents on this is I told actually the order that you are really putting like good elements in place, like protecting the nurses from a legislation point of view if they get assaulted, but we don't want to reach the point where the nurse is already assaulted. So let's train the nurses. We need a professional development training part before the legislation part, where we train them how to de-escalate during time of conflict. So the communication is very important, and how to really behave to really de-escalate a situation of tension, because this is going to occur. It's not going to end right now. In addition to how to do self-defense. So like if they are physically attacked, how they would really do that. Plus build something what we call code violence, or code violet if you want, like the code blue, but in case of emergency violence. So if you have, like, you can sense that the tension is going up, voices are going up, and like they are physically in an attack situation, you press a button, you call a certain hotline, and there is show of force that is coming from other places, like the security people, all those people. So we need those systems to be built in place, not only have legislation to protect the nurses. Like, we need to protect the nurses at the point of care. I'm very concerned about the nurses when they are at the point of care. The legislations are very important. They protect at the larger level. But personally, I come from the background of being practice-based. So I always think for the people who are at the point of care, how they are doing, what they are facing, what are their challenges.
Yeah, well, that actually took me by surprise. You were saying that nurses where you are getting attacked, so there needs to be a system in place to protect them, which makes sense. I'm here in the U.S. and I've been in nursing for 13 years, and I can't say that has really, I work in long-term care. So like getting physically attacked, I hear you say that. I'm like, wow. So it's a pretty known thing there, you're saying?
Yeah, it is documented. It is documented. Like when you work in emergency room, especially in emergency room, like violence in emergency room. And I think one of the nurses got assaulted by, it was on the news in the United States like a couple of years ago. I don't recall her name, but it was on the news. She was assaulted by one of the patients in the parking, and she reported that person. I think it was on the news. When you are practicing in emergency room or emergency department and being at the front line, this is one of the risks. Personally, I'm really employing this mentality or this mindset because I used to be trained before being an oncology nurse, or after that, I don't recall. I was practicing in mental health. So I know when you are practicing in a mental health setting and having the risk of being assaulted by patients, these were the solutions that we were used to protect our healthcare providers. So right now, if you have a community under tension and those situations are being recurrent, you need to employ same situation, same competency, and learn from this experience and transform it to the emergency room.
Okay. So, as a well-accomplished professional trainer and educator in both academic and professional venues, how do you encourage our nurses and our future nurses to keep going and pursue their nursing career?
First of all, I tell them to really take it easy on themselves. Listen to their bodies, and when their body cry for help or for rest, let them really take that piece of rest. Then they have to keep learning. Continuous education is very, very important. And learning is not only professional development, and if they want to really reach higher, academic training. So it's both. And let them not be detached from the point of care, because I think when you really are away or doing a desk job, and if you are not really in touch what's happening at the point of care, your solutions and your intervention won't be relevant anymore to those people. So you need to really all the time have this link with the point of care, so that your leadership is sound and your leadership is authentic and relevant to the people that you are leading.
Thank you for that. You said take it easy, listen to your body. If you need to sleep, take some downtime. You take some downtime, you sleep, you rest. And I also respect this. I love this. You said keep learning from both professional and an academic standpoint. Is that right?
True.
Okay. So can you tell us more about your role in the Premier Talent Acquisition Program, PTAP?
Yes. This is something that I have created for a commercial company that I work with as a healthcare consultant. And the Premier Talent Acquisition Program is a program that really assesses the need for an institution to recruit senior level people, especially healthcare, and how to match what type of tasks and recruitment strategies that you use to match what the organization needs with the appropriate talent and bring that talent on board to them, making sure that this person who is joining is somebody who fits their organization to a great extent. And it goes through a different level of testing, personality testing, other type of testing that we have really consolidated in one package, so that in addition to an interview with the senior executives in that organization or the host organization, and this would reduce the turnover of senior executives and middle managers. And this is very costly on organization when you have like a CEO who comes in, does not fit and leaves again. So this leadership void, or a CNE who comes in, she doesn't fit and she leaves. This leadership void is very costly for organization, and it creates a lot of indirect costs and indirect losses. So the PTAP comes into the picture to really do the match at a higher level percentage, so that they don't really have this turnover at the senior leadership level. And this is another problem in healthcare that we're not really touching upon, because we're really concerned at the point of care, but we're not talking about it today. But there is actually a problem in turnover at the leadership level.
So tell us about the progressive research. What is that all about, and what made you decide to work on it?
Well, I'm doing progressive research related to, this started during my doctoral degree and my dissertation. My dissertation was about the determinants or the predictors of job satisfaction and engagement in nurses through a professional followership model. So, and to keep the trajectory of my research, I started really building up other studies. I just released another study related to emotional intelligence and the application of emotional intelligence in testing. What is the right way of testing emotional intelligence as an ability? Because there are a lot of literature related to emotional intelligence, but we don't really treat emotional intelligence as an ability like the IQ. We treat it like a trait or a personality or whatever. But this article is being reviewed right now. When we want to test emotional intelligence as an ability, what is the best approach? And this is what is the article is all about. Also, I'm partnering with other colleagues in Lebanon to really do research related to emotional exhaustion of frontline nurses during the pandemic, and what are the predictors of emotional exhaustion. And we are linking this to how well they were trained on dealing with patients with COVID. What is the organizational support that they have received, and what are the coping mechanisms that they have employed so that they really control and manage their emotional exhaustion, and what is the level of emotional exhaustion they were really suffering from. Lebanon was hit by two major waves during the pandemic, one in December and another one in February, March 2021. And right now we have another pandemic we have another wave during Omicron, but it's not really severe in terms of mortality. Our study really covered the first two waves, wave 1 and wave 2. Our data collection was 6 months after wave 2 ended. So we wanted to really measure retrospectively what was the emotional exhaustion level. We did not reach the burnout, so we wanted to really assess the emotional exhaustion. And surprisingly, what really was I was very happy to know that our nurses, or the people who responded, they had a certain level of physical exhaustion and emotional exhaustion, but they tried to compensate so that it does not reach the patient, because we used an instrument that really tests the emotional exhaustion at which level it is, and is it physical, is it emotional, and is it reaching your colleagues and your patients, or are you able to compensate for that? So luckily enough, the nurses who responded back then, and this is a representative sample, were able to really compensate from the repercussion of emotional exhaustion on the care to their patients. But this is what I was telling you, Jamie. They can do this compensation for a certain period of time. But if we don't intervene in the right place at the right time, so that this compensation is really supported, so that it does not reach the patient, eventually it's going to reach the patient. And once it reaches the patient, they're going to take a decision to leave the profession. So I think this is an interrelated, multifactorial thing, but we need to do those interventions that I told you earlier about, like the shorter shifts, the
Right.
shorter weeks, the supports for nurses from a well-being perspective that is comprehensive, not only physical well-being.
So going back to shorter work weeks, shorter shifts, because money can only
push you for a little bit, yes, for a little while, but it will not really buy you time. It will not buy you health. It will not buy you rest. Okay, so eventually we're human and we need those. So it's important to be very well paid, so that you can afford help, you can afford daycare, you can afford whatever. But eventually you will need those shorter weeks, shorter shifts. It's the same. It's the money that you want to put into the pay. Put some of it into shorter weeks, shorter shifts, plus healthy well-being programs that are part of the work trends or part of the work program and systems in hospitals.
How are you finding balance in all that you do?
Well, I don't have the pressure of being married and having kids, so this is another thing. And when I chose to move into consultancy, I'm trying to really right now balance out the time where I work. So I choose the time, how I work, when I work. Sometimes it's really overflowing on my weekends and my night, because I want to do like shorter days. But eventually it's balancing out well. I did not really succeed in really blocking time that is off with no projects, but I'm really working on that.
Not having kids makes a big difference too.
Yes, yeah. This is why I mentioned it as the first point. I said it as the first point.
So what are your thoughts on the community? How do you think nurses can benefit from the NurseDex community for nurses?
Well, I think NurseDex can really play a big role in really like this interview, for example. It's like a learning message, a lot of learning message for them. NurseDex can be like an exchange platform where they can exchange know-hows, lessons learned. Well, they do a lot of this on Facebook or on any other platform, not necessarily. So NurseDex can really play the same role. It can play the role of advocacy for nurses, like do events where advocacy for nurses and nurses' issues are put at the forefront. So it's especially that the community is not really limited to the United States, so it's like an international community, so it can has a wider reach, and slowly but surely this can be built up to really bring those issues on the table, on the platform, and really create a way for useful discussions, meaningful discussions about those issues, and then come up with recommendations, so that would really transform later on into legislations or position statements or whatever you name it, something that can really affect actually the situation on the ground.
Yeah, I'd like to mention that I've done several of these podcasts, and you have emphasized a topic that not others have really mentioned or emphasized, and I couldn't agree with you more. The profession is exhausting. We are human. We're not superheroes. I know a lot of times, people have mentioned how money helps, and of course it helps. We have to make a living, but you emphasized how we can't fix this problem by paying more. We have to break the cycle, like you said earlier, from learning from other professions. And so you've emphasized how one of the ways to help is by shorter work weeks, shorter shifts. So thank you for that.
I hope it will come true one day.
Yes, me too. I do.
That would be something that I would like to see for nursing to
Me
happen.
too. Me
And
too.
and believe me, when people when I teach students as well. So when you are recruiting nurses or student nurses for the program, and you tell them when you graduate you will be working shorter weeks, like if 3 days a week, shorter shifts. Oh, this is the dream work that they want. So
Yes,
you will not have any problem at the recruitment level. Now we are having a big problem in recruiting nurses to be trained as nurses, in student enrollment. That they start the program and we lose them to somewhere else because they want to make money and they want to have a shorter path and they want to have more. So you need to make the profession appealing, and it's no more. I agree with you, it's a calling in a way, but it has to be appealing. It's a high risk profession, we need to admit this, and we need to treat it as such so that we can sustain healthcare. We need to really build this in our mind. If we don't think that nursing is sustaining healthcare, nothing will be done. And I think the pandemic, in a way, has really exacerbated the vulnerabilities, but has highlighted very truly that nurses are essential for the sustainability of healthcare.
yes. I work in long-term care, post-acute care, like skilled nursing, assisted living. We have nurses working 16 hours for like 5, 6 consecutive days, and they are just completely exhausted. And
Can you imagine the type of quality of care that they provide? Do you think they are doing any patient education?
exactly.
I'm pretty sure that's to speak about the patient education only, not to speak about other type of care that is missing.
Right. Yeah, it's not sustainable. You
It's not
can't.
sustainable. You cannot do this for a long period of time.
So, is there a topic you would like to discuss or address that we have not mentioned?
Well, maybe my hobbies. And every nurse should have a hobby, because this is one way of really relaxing and going outside the breaking the cycle of exhaustion and demand in a demanding job. So I love cooking. I'm a big cook. I love cooking, and I cook many types of cuisines, Italian, Lebanese. I'm trying to initiate myself into like Asian, but I'm not really big a big person on the Asian cooking. I like to eat sushi a lot, but not a big Asian cook. And I'm a good swimmer. So these are two things that I love to do. And that's why I'm telling you it's very important to really grow a hobby so that you have something to do when you're not on duty, when not you are doing work, and you break the cycle of a demanding job. Not necessarily a physical hobby like sports or something, but something that would really break the cycle in your mind, because you need your mind to rest a little bit as well.
You're right. You got to have some self. You got to have some me time. And for you, you like to cook and you like to swim, right?
Yeah.
Yeah. So, are you on Nurse Tech Social?
Yes, I am, but they have requested from me the licensure, and my licensure is different than others because I'm located in Lebanon. So we need to work those little logistics with NG.
Definitely. Well, I would love to continue the conversation on there. And thank you so much for your time today. It was a pleasure interviewing you.
Thank you, Jamie, for your time, and thank you for hosting me. It was a pleasure discussing all those issues, and you took me back in years. So compacting all this in a short period of time. Thank you so much for having me.
Thank you so much. Have a good one.
It was a pleasure.